Greetings, lovely people of Ghana and beyond. This is a teacher, Frankie Aboa. Today, I'm here to do the usual thing. I'm here to educate. I'm here to inform and somehow to entertain. Today, I'm going to talk about a deadly disease normally affects people, and more especially in Ghana, and it's disturbing the youth. As for the youth, whenever I'm talking about the youth, then my heart is piercing. Today, what am I going to talk about? I'm going to talk about a disease known as tuberculosis. In short, TB. Now, TB. Some people think TB is a viral infection or viral disease. TB is not a viral disease. TB is a bacterial disease, and then TB is caused by a bacteria called Mycobacterium tuberculosis. And then the bacteria normally or usually attack the lungs, but sometimes TB bacteria can attack any part of the body. It could be the kidney, it could be in the brain, the spine. So you see, TB is very dangerous. It's very dangerous. And not every infected person with tuberculosis is normally becomes sick. Sometimes you have it and you not show any sign. And when this COVID came, we heard of asymptomatic. Asymptomatic is a person with a disease but not showing any sign. So they use them often. Sometimes to TB to people become asymptomatic, and then such people asymptomatic patients normally spread diseases because the person is not showing any sign. So the person may not cough, may not do anything, but the little thing that the person does can affect other people. But when you see that someone is a TB patient and the person is coughing just like that, I don't think you will get closer to the person. Not if the person is asymptomatic. If the person is asymptomatic, you will not know that the person is having that particular disease. Then, what are we going to do? Today we're going to look at types. We're going to look at types of TB. We had the one we call the active TB disease. Active TB or active tuberculosis. Then active tuberculosis is an illness that normally invade rapidly and multiply and then affect most of the organs of the body, and then the organ that suffer most is the lungs. So mostly those TB that we see are the active tuberculosis, and they are very deadly. They invade rapidly, they spread rapidly, they move quick. And then we have the Miniary TB. The Miniary TB is a rare form of active disease, and that occurs when TB bacteria find themselves in the bloodstream. This one, they normally find themselves in the bloodstream. So the Miniary TB or tuberculosis normally find themselves in what? In the bloodstream. Unlike the active one that normally happen in the lungs, in the spine, in the brain, or other vital parts of the body. But this one normally they find themselves in the bloodstream. Then we have the latent tuberculosis infection. And then many of those who are infected by the latent tuberculosis disease normally they have no symptoms, don't show any symptoms. Even the X-ray on their chest will be normal. When they take X-ray on their chest, everything is normal. Everything is normal. But however, the risk increase when a person has a disease like HIV. As for HIV, when you have HIV, the virus normally affect your immune system, so your immune system becomes so weak. But apart from that, if you have the latent tuberculosis infection and then you don't have any disease like HIV, you will not show any sign. But that's why it will affect you more when you have a disease like HIV, because after that one, your immune system will be very weak. Unless you are taking the medicine, the antiretroviral. If you're not taking the antiretroviral, then that's when the latent TB infection will weak your system. Then someone will say, what are some of the symptoms, signs, or warnings of tuberculosis? One is cough. Normally anything that happens in your lungs automatically let you cough. So since the TB, the active tuberculosis normally affect our lungs, definitely you're going to cough. So if you are coughing repeatedly, continuously, unabatedly, then probability of you having tuberculosis is very high. And what you need to do is that you need to see your medical practitioner or medical doctor. If you do that, in any disease, before it starts, doctors or physicians or medical practitioners normally cure it very fast when the disease is at its early stage. So please, when coughing, you definitely don't go and buy any cough mixture. Go straight to hospital and then go and do a test and see, because now it is rampant. It is increasing. Tuberculosis is increasing. It's affecting people. So please, lovely viewers, do that quick whenever you show some symptoms of cough. And also coughing up blood or mucus. When you cough in blood, you cough and then you see some sort of blood in the mucus. Hey, what must you do? You need to see a medical doctor. Because it's not normal. And also sometimes chest pain. We do this chest pain. You normally feel some pains in your chest. Whenever you do that, you feel that, please, it's a sign, it's a warning, it's a sentence that can tell you that you have a tuberculosis. So go to the hospital and go and do a test. And also pain with breathing or coughing. Sometimes when you are breathing, when you are coughing, you feel so pain. You feel pain. You be panting. You can't even cough well. You feel pain in the cough. Sometimes when you cough, you feel it within. It's a sign. It's a warning. It's a sentence. Better go to the hospital and go and do a test. And also fever. You normally feel feverish. You get fever frequently. Hey, my sister, my brother, it's a sign. And also nice sweats. You sweat at night profusely. You sweat too much at night. It's a sign. I will tell you that, my brother or my sister, tuberculosis is knocking at your doorstep. And also Weight loss, yeah. One sign of tuberculosis is weight loss. Weight loss, you become slim. You become slim. So please, when you are coughing, you sweat at night, you feel chest pain, when you cough and there's blood in the mucus and so on and so forth, and you are losing weight, don't sit down, because tuberculosis kills. It's deadly. It's deadly. If you don't treat it at its early stage, it's not easy. I quite remember when I was young, my grandfather had some. That was in 1994, way back in 1994. And my grandfather took about 90 plus injection. 90 plus injection. When he finished taking the injection, one leg got spoiled. One leg got spoiled. So it wasn't easy. But now doctors, they've gotten a cure. So please, when you find it at its early stage, it will be very easy for you to cure it, for them to cure it for you. So please, when you go and do the test and then say you have gotten a tuberculosis, don't feel panic. Don't be panicking. Don't be panicking. Don't be panicking. Now we have a cure for tuberculosis. A cure for tuberculosis. And also tiredness. Any trivial thing you do, you feel so tired. Any trivial thing you do, you feel so tired. I'm tired. It's a sign of a tuberculosis, and a sign of a tuberculosis. And also not wanting to eat. Loss of appetite. You don't feel like eating. Then it means you it's a sign. All these are signs. It will be determined by the medical practitioner. But what will let you go to the hospital is when you're experiencing all these signs, or some of the signs that I've made mention, or I am mentioning. So it doesn't mean that when you feel tired, when you do that, you say you have tuberculosis, you go to the hospital, go and buy medicine for yourself. No, go pass through the right channel, please. Pass through the right channel. And also, always not feeling well. Always you are not feeling well at all. Always you are not feeling well. When this happens, go to the hospital. Then how to prevent tuberculosis? You can do that. And there's a good ventilation. Why? Because the TB infection, the bacterial that causes tuberculosis can stay in the air for so long. So when you have a very good ventilation, the still air, the fresh air will just suck. Let me do that. Remove the stale air, and then those bacteria will be brushed out. And then, if you are a second person, getting it. So when you are with a friend that you are seeing those things, sometimes you need to have be opening your windows, and then if it is AC or if it is fan, you need to have the room. The ventilation in the room should be very good. And also natural light. Ultraviolet ray is very good. They can kill the bacteria very well. So sometimes those people can sometimes sit in the open, and then when you cough, when they cough, the sunlight will kill those bacteria, because of the UV normally kill those bacteria. UV, the ultraviolet ray from the sun, they kill bacteria. So natural light can also do that. And also good hygiene. Why am I saying good hygiene? When you are coughing, please cover your mouth. When you are coughing, cover your mouth. Don't just go in a vehicle, then you just coughing just like that. No, you need to cover your mouth. If you don't have a handkerchief or a tissue, just do something like this and cough. Do something like that and cough. Please don't just cough into the air just like that. Please, we need to help ourselves to avoid this deadly disease, to avoid this deadly disease, So we have seen what tuberculosis is, the causes of it, types, and then symptoms, and then how to prevent. For the prevention, we talked about good ventilation, we talked about natural light, and then that of good hygiene. Good hygiene. So, like I've been saying, I've been doing all these things I'm doing is a research that I'm doing. I'm not a medical person. So if any of the words, I did not mention them well, please pardon me. I'm just a common teacher. And doing my own thing with the help of other staffs, research tools. That is what is helping me. I'm not a medical person, but I do research. So sometimes the words I may not be able to get them well. Just pardon me. And then if you can mention those one, you can leave it on the comment section for me. We are all, and a teacher is a facilitator. A teacher is not all-knowing. All-knowing is one person, that is the Jehovah God, who is all-knowing. He knows everything. Even professors are still learning. How much more a common teacher like me? So like I've been saying, if you like this video, you just subscribe. Please, the subscription is not coming. Please just subscribe, so that to give me the edge, to give me the flair to do more research, and give you more quality and beautiful video pertaining on our health. Okay, so until then, like I say, it's a teacher, Frankie Aboa. Until then, goodbye.